Hi, everyone. This is Dr. Sonia McGowan, and we're just about ready to start our webinar event. We're going to give people just a couple minutes to get in and get settled, and then we will get started. Hope everybody's having a great Friday. Looking forward to the weekend. If you have any questions or comments, you can drop them in the chat box. I'll be happy to answer them, as I'm able to during the presentation. So you will also have access to this as a replay as well. So, all right. So let's just give people a few more seconds and then we will get started. All right. Letting a couple people in here. Okay, so it is noon and right on the dot, so let's go ahead and get started. So again, my name is Dr. Sonia McGowan. I'm the owner of Covenant Pediatric Wellness Center in Jefferson City, Missouri. And today we are continuing our test session, our series on testing for complex kids. And so last time we talked about organic acids testing, the metabolomics test. And so today we're talking about the comprehensive stool analysis. So just a little bit about me. Most of you probably know me already, but I am a chiropractor by trade. I am married to Shannon, who is a CPA. We have two fantastic kids. We have Libby. She lives in Kansas City now. She's a music director for School of Rock. She's quite the gifted musician. And then we have Rowan as well. He is now off in college in Illinois. And, my experiences with parenting him are really the reason why my clinic is the way it is today. He was a kid with lots of challenges to overcome when he was tiny. He was nonverbal until the age of about 4. And by the time he made it to kindergarten, he was indistinguishable from his peers. So all of his sensory behaviors and self-injury and aggression were gone. He was fully verbal. And so I really do consider him my first recovery story. And then, of course, you see Lola there. We're coming up on the 10-month anniversary of her going to puppy heaven. She was our English bulldog. We had her for over 9 years, and she passed away just after Christmas last year. So she still gets to be in the slideshow because we still expect her to walk around every corner when we're at home. So again, I own Covenant Chiropractic and Wellness, Covenant Pediatrics. And so all together we call it the Covenant Pediatric Wellness Center. And so we do a lot of things here. We really do specialize in complex kids. And so that means, kids with autism, kids with ADD, ADHD, PANS and PANDAS, and literally, anything else you can imagine. We really love kids with those kinds of challenges. And so we do a lot of brain-based chiropractic. We do functional nutrition, craniosacral therapy. We also, a big part of our practice is the work we do with oral restrictions. So tongue ties, lip ties, cheek ties. So we offer comprehensive evaluation and intervention for those oral restrictions. We really are, one of the premier places in Missouri in order for kids to have that comprehensive evaluation. We also work with pregnant moms and new babies. We do nutrition and other lab testing for, just your average folk. And then we also have Covenant Pediatrics, which is a specialized medical pediatric practice for kids birth to 18. So we have Dr. Hannah Strong on staff. She is a general pediatrician, and so she sees kids of all ages. And so what I am really hoping to get across in the messages we put out on social media and other avenues is that we really believe that the why matters. So there are no bad kids and there are, no purposeless behaviors. There's always a reason behind what's going on with the child. And so what we try to do is not band-aid those concerns. We don't just say that something is, just because they have autism, right? We really try to look deeper and figure out what is the why behind self-injury or constipation or sleep disruptions or sensory seeking, sensory avoiding. We're really looking for the metabolic, physical, nervous system reasons for why a child might have the symptoms and behaviors that they do. So we're going to talk about 3 of the major stool tests that I most often use in practice. We're going to talk about the Comprehensive Stool Analysis from doctor's data. We're going to talk about the GI effects from Genova Diagnostics, and then the GI map as well. So in general, the components of comprehensive stool tests include bacterial diversity. So we're looking at what are all the flora in the intestine, how diverse is that? How many different types of bacteria or flora are present in that child's microbiome? And then we want to look at the composition of that microbiome. So the bacteria, the yeast, we also look at some viruses, and depends on if it's ordered or if it's included in that test, we will look at parasites via a stool test as well. And so when we're looking specifically at the comprehensive stool analysis, we're looking at digestive function. So it's telling us about elastase, which is a marker of pancreatic enzymes. So enzymes are the molecules that help break things down. So we have enzymes in our saliva, in our stomachs, in our small intestine. We have enzymes that come from the pancreas. And so many times, especially in complex kids, what we find is that kids don't have really robust levels of enzymes. And so that creates a faulty digestion or a maldigestion. So that really, first level of digestion isn't working as well as it should. And so, when the beginning doesn't work very well, the end is not going to work very well either. It also looks at fat and carb digestion. And I'll tell you, across the board, it's very, very common for me to see complex kids who do not digest their fat very well at all. So this is a really important component to look at for complex kids. And then short chain fatty acids, we look at those. Those are basically food for the colonocytes. So the cells inside the intestine, they're very anti-inflammatory, and they give us a nice look at, why a child's diversity of their microbiome might not be where we need it to be. We also are looking at inflammatory markers. So does the child have markers inside their intestine that tell us that there's a lot of inflammation happening? There are a couple of different ones. There's lysozyme, there's calprotectin. Both of those are the most common. Some tests will also include what we call eosinophil protein X, also an inflammation marker. We're also looking at immunology markers. So is the immune system really over or under responding specific to the digestive system? We're looking at whether there's blood in that stool. And then we're also looking at the pH, because the pH of the stool should be in a certain range. If it's too low, if it's too high, that gives us information about what is happening in the digestive tract. So we're going to start first by looking at doctor's data. So these are snippets of what that report looks like. So on the first page of the comprehensive stool analysis from doctor's data, it's telling us about, on the left there, expected beneficial flora. So these are flora, bacteria that we expect to be in the digestive tract. We want them to be in nice high numbers. And so if you see an indication here, for example, that says NG of lactobacillus, what that means is there is no growth of lactobacillus in that patient's microbiome. And that's a problem, because we need lactobacillus in large amounts. And so what that really speaks to is a lack of balance in the microbiome. And when that happens, it allows less beneficial flora to sort of proliferate. And so that's what we're seeing here in the yellow section. So this is commensal or imbalanced flora. And so you can see this child has 3 different kinds of bacteria, not in super high levels, but high enough to be of concern. Now, if this were my stool test, a neurotypical person, if it was, my daughter's stool test, I wouldn't be particularly worried about this. But when it comes to a kid with complex needs, any sort of variance outside of normal, any kind of outlier in terms of that normal data, I'm going to pay attention to it because our kids are just so sensitive, and their metabolic processes are sometimes just so disrupted that we need to pay attention to even the smallest differences. This is, again, a continuation from page 1 of the Doctor's Data Comprehensive Stool Analysis. This is the yeast culture. So we're looking at when they cultured this stool, did any yeast show up? Now, this shows us no yeast at all, which is great. However, what I always tell parents is what we're looking at is one stool collection, and knowing that yeast grows in colonies. Sometimes there's not adequate yeast spores in every single stool collection. It just kind of depends on which poop you gathered that day. So accurate based on what is present in that stool. And so here we're looking at some additional viruses. So page 2 of this test gives us additional viruses and other pathogenic bacteria that could be present. And as you can see, this child is completely clear. Everything is in the green here. But this is a really nice addition in case there are other things that we might be looking for on that stool test that could be pathogenic. And so here we go, looking at that level of pancreatic enzymes, that elastase. So you can see what we want is more than 500, or sorry, we want the reference range is more than 200. This child has more than 500. So what this means is this child's pancreas is making enough enzymes. There are a few fat molecules. So what that means is the child is not very robustly digesting fat. So some of that fat is passing through into the stool, but they're doing better with carbs. So that's negative, meaning they're not passing carbs through into their stool. So remember we talked about short chain fatty acids. There are several of them. And so what we're looking at here is that list and then the total short chain fatty acids. And this child is all in the green. So their short chain fatty acids look really nice. And here we're looking at the inflammation and immunology markers. Again, this child looks fine, but what we're seeing here, we have lactoferrin, we have calprotectin, we have lysozyme. These can help a doctor differentiate between some inflammatory conditions specific to the intestine. And then the secretory IgA is also very important. Our reference range is 30 to 275, and you can see this child is about 70. So technically they're within the reference range. The secretory IgA is a class of antibodies that acts as a first line of defense against pathogens. And so it's really common for me to see a child who has a long list of pathogens on page 1, but then their secretory IgA is practically non-existent, right? And so if you've got pathogens on board, you want that secretory IgA to be, on fire, ready to fight. It's basically telling us that the immune system is on point. It's recognizing that there are pathogens and threats in the area, and the immune system is working against those. And so it's really common for kids to sort of have an immune system that's dysregulated, it's downregulated, it's not paying attention to the threats in the intestine. So that's a super important analyte for us to look at. So still, again, with the doctor's data test, we're looking at pH. This child's pH is fine at 6. There's no blood. The color and consistency were normal. Now, we're going to transition and look at a similar test. This is called the GI-FX. It's from Genova Diagnostics. And so this test is kind of looking at 5 specific areas. So we're looking at inflammation, we're looking at dysbiosis, metabolite imbalances, infection, and then maldigestion. So these are really the 5 pillars that the GI-FX looks at. And so again, what we're seeing here are those 5 pillars. So the maldigestion, inflammation, etc. So it gives you kind of an overview, a summary on the first page. And then as we sort of dig into that test, we get the commensal abundance. So how much of the good bacteria does this child have? And then it gives us some dysbiosis patterns. So depending on where that child's test falls, it will tell you over here, do they maybe have increased intestinal permeability, or do they have an increased pathogen load, etc. So it's a really nice graphic to help us understand where this patient's dysbiosis patterns are. And then we have the balance. So do we have enough of all the different types of flora in the intestine? And so here is where we're going to start seeing some similarities really between that comprehensive stool analysis and the GI effects. So we've got the pancreatic elastase, and as you can see, it kind of gives you a continuum here. And so this is where that child lies. And so their pancreas, again, is making adequate levels of pancreatic enzymes. This is products of protein breakdown. So are they passing a lot of protein out into their stool? And they're not. And then our fecal fat. So this test breaks it down into the different types of digestion, the digestion of different types of fats, sorry. So we've got triglycerides, long chain fatty acids, cholesterol, phospholipids, and it rates each one of those as to do they have maldigestion of those particular types of fats, of fecal fats, and how severe that is. All right. Now, this is our inflammation and immunology section. So this test kind of groups those together. So again, we've got the calprotectin on this test, and then the eosinophil protein X that I mentioned before. And you can see the child is fine on both. And then our fecal secretory IgA, right? So that's that first line of antibodies against a threat. And you can see that this child is in the yellow. So there's definitely some immune system activity around the pathogens that are in the intestine. And then these are our short chain fatty acids again. So you can see this child is sort of all over the place, right? So they're low, they're normal, they're high. So what we would really work to do is to kind of bring all of that down to the middle, so that we're normal on all areas of those short chain fatty acids. All right, now this is the bacteriology and yeast culture section. So we've got our beneficial bacteria here, and you can see again, we've got the no growth of a couple of those good beneficial bacteria in this section. And then down here are some additional bacteria that were found. So this child happens to have potentially pathogenic levels here of a couple of different bacteria. And then down here, we've got yeast. And so you can see this, the yeast level is a little bit elevated. These are two different kids, by the way. The first test that we looked at is one child. This is someone else. So it's not, I'm not trying to show that one test was wrong with yeast and one was right. They're totally different patients. All right, so still with the GI effects, part of one of the major differences with the Genova test that I do is that it includes a parasite test. With the comprehensive stool analysis, we can add parasitology for an extra fee. So this is telling us this long list of parasites that none were detected. And again, more parasites showing us that none were detected. All right, so that was the GI effects from Genova. Now we're looking at the GI map. And so with this test, we're looking at genetic information from these different types of pathogens. So we have a long list of bacterial pathogens, viral pathogens. And so if something is out of range, you'll see that it will be noted in red, like this. So this is a child who has a high level of H. pylori, which is the bacteria that will cause ulcers and other difficulties with the digestive system. And so it breaks it down really nicely into certain bacteria that can have different effects on the body. So we've got here potential autoimmune triggers. This is really important if we're looking at, a child who has some sort of autoimmune situation, like, maybe they have thyroid challenges, or maybe they're a child with PANS or PANDAS. This is going to be an important test for us to look at so that we can see these potential autoimmune triggers in the intestine. And here we go with the fungi and yeast, and again with some viruses. And then also with parasites. So parasites are included as part of the standard panel with the GI map. So we're looking at protozoa and worms, a wide variety of parasites. And so this is, again, that section that we've seen before. So we've got elastase. So remember, this is the marker of, is there enough pancreatic enzymes at play for good digestion? The steatocrit is basically the fecal fat. So is that child passing fat through into their stool rather than digesting it and using it for metabolic processes? And so you can see it should be less than 15. There's this 22 that's high. So there's a high level of fat in the stool for this child. And that's important for us to know, because fats are a really big deal for kids with complex needs. We see kids who generally have, fatty acid deficiencies. They tend to have low cholesterol, and generally their livers and gallbladders aren't super happy and robust. And so we see just a great deal of fat maldigestion in complex kids. And this is important because you've got to have plenty of fat for good brain development, for hormones. And so when kids have low cholesterol, low levels of fats, it creates, many times mitochondrial dysfunction as well. So go back and watch the mitochondrial dysfunction webinar so that you can understand all of that. But fats are extremely important for our kids. We also see some other GI markers here in terms of beta-glucuronidase. We see fecal occult blood. And then here we go with the immune response markers. So we've got the secretory IgA, anti-gliadin IgA. So this can speak to any sort of gluten negative response. And then here with the secretory IgA, you can see this child is low. So they're under responding to the pathogens that are in their intestine. And then here we have the inflammatory marker called calprotectin. So what do these tests do for us? Why do we care? What do we do with this information? So generally in my practice, this tends to be one of the first tests I consider for most complex kids, especially if they have any sort of GI complaint. So if they're gassy, if they're burpy, if they're bloated, constipation, diarrhea. Sometimes kids have both constipation and diarrhea. If, family reports that they see undigested food in their stool, these are all really strong signs that they need a stool test. And so this is one of the first ones I consider. Generally, the very first one is an organic acids test or the metabolomics. So look at the webinar from last month for more information there. So I will use different tests just depending on how the child presents, what their history is, what their signs and symptoms are now based on, history and exam. So sometimes I'll use the doctor's data test. Sometimes I'll use the GI effects. It really just kind of depends on, again, what the child's symptoms are. And so these are tests that have to be ordered by a licensed professional. So have to be ordered by a doctor. But sadly, few mainstream doctors really are familiar with this test or how to interpret it. But it's a test I do very frequently. So I use this test because it gives information specific to digestion. And what we know about complex kids is, as a general rule, they're not great at digesting their food. And so their digestion is inefficient. Sometimes we call it maldigestion because they're just not able to do with their food what they need to. And so while it's a bit of an investment, it does give us a lot of data, and that data translates into intervention. And so prices vary generally from about $249 to about $399. So, and there are some insurance options kind of depending on where you stand with your in or out of network deductible. So if you pay cash, you do get a better price for that from the lab. And so how does this test change intervention, right? So we don't want to just test a kid to death and then do nothing with that information. I like that, any test that we can do that's non-invasive is a plus, right? So urine is great. Stool is also great because it's non-invasive, and generally it's fairly easy to get a stool sample from most kids. And it allows me to be very specific in how I write the care plan to intervene with what their signs and symptoms are. And so because we tested, we're not guessing about what a child needs. We're not wasting time. We're not wasting money. We're being very specific, very strategic, and, very individualized for that particular child. We're doing exactly what they need, and doing it in the right order, because, I look at every test, no matter what test we've done for that child, I look at it as a big picture, and that's how I approach it. And I use that data to then prioritize. What are we going to do first? What's our first goal? What's our first benchmark? And then we move along from there. So it lets me prioritize and be very strategic about how we intervene. So as a summary, each of these components are valuable, and they give us insight into the state of a child's gastrointestinal health. And so it's really good because it can guide me in developing a very personalized care plan for kids with autism or other gut-related issues. And please remember that the interpretation of these components of the test should be done by somebody who has experience and expertise in, functional approaches, gastrointestinal health. And so don't forget, the why matters. It's very, very important that we get to the bottom of a child's behavior and get to the bottom of their symptoms. We don't need a Band-Aid, right? We need to get to the real cause of exactly what's happening with that child and work to correct whatever errors we find in metabolism, whatever errors we find in digestion, so that we're getting to the actual root problem of the child's symptoms. So this is my contact information. If you have any questions at all, you are more than welcome to email me at drsonia@covenantwellness.net. You can find us on all the social platforms. The phone number is here. If you want to call, if you have questions, if you'd like to make an appointment, we are taking new patients. So our pediatrician, Dr. Hannah Strong, is taking new patients birth to 18. I'm taking new complex kids appointments. Dr. Kayla Nieper is our associate chiropractor, and she is taking new chiropractic patients as well, of all ages. And then, of course, we have Jackie Stuber on staff too. She is our physical therapist and craniosacral therapist, and she requires a referral to be able to see. So again, if you have any questions at all, you can look at our website, you can give us a call, and we're happy to answer any questions that you have. So Laura High asks, can these tests tie into sensitivities or low cholesterol? Yeah, actually they can. So sometimes when I see elevations in those inflammatory or immunology markers, it can point us toward the need to do some food allergy or sensitivity tests. And when I see that a lot of fat is passing through into the stool, it is a clue to me that it would not surprise me if that child had low cholesterol. So yeah, so it can definitely, for a practitioner who is experienced here, it can give you pearls of information that can then lead you to the next right thing to do, for sure. Great question. All right, guys. So thank you so much for coming and listening to the webinar. You can also, again, have access to this because you registered. You'll get access to the replay. You can also watch the replay on our website, thewhymatters.net. We keep those replays up indefinitely, so you can go back and look at any of the ones that we've done. So if you have questions about mitochondrial dysfunction, about the organic acids test, about low cholesterol, PANS, those are all topics that I have covered. Next month, what am I doing? I think in November, the topic is bioresonance testing. So hair and saliva testing, it's fascinating. You wouldn't want to miss that. So that will be, I believe, November 3rd, whatever the first Friday is. is when our next webinar is. So again, if you have any questions at all, feel free to shoot me an email, and we will see you here again next month as we talk about bioenergetic bioresonance testing. All right, guys, have a great weekend. Thank you.